Okay, so today I'm going to be doing some patient education for a patient that's being discharged home from the hospital. He's going to be going home with 3 different medications: a small volume nebulizer, MDI or meter dose inhaler, and a DPI, dry powder inhaler. So I just need to give him some education. Ideally, I would print off stuff off of the computer for each one of those and different meds. That way he could have something to reference from home. So I've already gotten all my necessary equipment that I need to do his, to administer each one of these meds for him and show him how everything works. I just want to take a glance in his chart and see what his diagnosis was, any other pertinent information like allergies, verify my orders, make sure I have those right. So it looks like he's got COPD exacerbation that he's going to be going home with. So we need to wash my hands, put my gloves on, knock on the door as I'm going in. I'm going to introduce myself. Hi, my name is Jen. I'm from the respiratory department, and I'm here to do some education for you for some different medications that you're going to be going home with, and we'll go through and I'm going to administer each one of those meds and help you with those. If you have any questions, please feel free to ask as we go along. If you could verify your name and date of birth for me. So it's Mr. Oscar Smith. Tell me his birthday. So the first medication that we're going to do is small volume nebulizer, which you can see the different pieces here. Some of them are already get together. So I want to position him on the side of the bed or the chair, wherever he happens to be sitting, and then just do a quick assessment. I need to check for heart rate and rate and rhythm, respiratory rate and rhythm as well. Listen to some lung sounds, front, side, and in the back. And then I would go over how to assemble the equipment for him. So this is the bottom cup, which I've already dumped in my medicine, so I'd show him how to twist off the top and then just squeeze it in there, and then this goes on the top, and he's got his little T-piece here. It goes up here, and then his reservoir, which it only fits on one side, so that's easy enough to figure out. So mine fell. Mouthpiece on, and then this is going to go on the bottom. There's a little thing there, and we hook it up to our oxygen. Okay, so like I said, this is Brovana. It's a long-acting beta-2 agonist. It's 15 mics per 2 mLs, and he's going to be doing it twice a day, so once in the morning, once at night. It's pretty much just a bronchodilator in easy terms for him. So he may get a dry mouth, may make him a little nauseous. You need to, tell him about some of the side effects he may see from this. So he needs to make sure he places the mouthpiece in his mouth, creates a good seal, and he's going to just take slow, deep breaths through this with the occasional hold. So turn this on and start it for him. And I could talk to him as he's doing this. If he has any questions, he can always ask me. This will take about 10 minutes to do. So it'll probably be the longest one he's going to have. This is more of his rescue inhaler, kind of. It's more quick acting than the other 2 meds that he does have. Okay, so we'll assume 10 minutes has gone by, give or take a little bit. Turn that off. I ask him if he has any questions about the medication or how to use his small volume nebulizer before we move on to the next one. So then his next medication he has is meter dose inhaler, which is this right here, and it's QVAR, which is a corticosteroid. It's administered twice a day, 1 puff. It's 80 mics per puff. So this is to reduce any of the low lung inflammation in his lungs. It'll last about 12 hours, which is why once in the morning, once at night. So, cap, boot, and his canister, which is already in there. So he needs to make sure it's clean, shake it up, maybe waste a dose before he would actually try to inhale his dose. So first he would